Question 1. A sterile processing technician is printing a lot control label for a newly sterilized instrument tray on February 15, 2026, a non-leap year. What is the strictly correct 5-digit Julian date that should appear on this tracking label? A. 26,031. B. 26,046. C. 26,015. D. 26,365. Correct answer B. Knowledge point explanation. Core rationale. The standard Julian date format used in sterile processing lot control is a 5-digit number, YYDDD. The first 2 digits represent the year, 26 for 2026, and the last 3 digits represent the continuous number of days elapsed since January 1st. In a non-leap year, January has 31 days, and adding the 15 days of February results in 46, formatted as 046, making the complete number 26046. Trap analysis. Option A is incorrect because 26,031 represents January 31st of 2026, which is only the end of the first month. Option C is incorrect because 26,015 represents January 15th of 2026, ignoring the preceding month's days entirely. Option D is incorrect because 26,365 represents December 31st of 2026, the final day of a standard year. Concept extension. Maintaining strict lot control numbers is a mandatory requirement from the Centers for Disease Control and Prevention, CDC, and the Association for the Advancement of Medical Instrumentation, AAMI, to facilitate immediate and precise recalls in the event of a positive biological indicator. Question 2. A patient develops a severe surgical site infection 6 months after a joint replacement surgery. The hospital's risk management team requests the sterilization logs from that specific day. In this situation, what is the primary function of these accurate and complete records? A. To determine the technician's continuing education hours. B. To serve as a legal defense demonstrating that all standard operating procedures were followed. C. To track the inventory levels of biological indicators. D. To evaluate the mechanical efficiency of the ultrasonic cleaner. Correct answer B. Knowledge point explanation. Core rationale. Sterilization records are official legal documents. In the event of a healthcare-associated infection claim, these precise logs prove that the department adhered strictly to recognized standards and achieved proven lethality before releasing the items. Trap analysis. Option A is incorrect because continuing education hours are maintained in personnel files, not daily sterilizer logs. Option C is incorrect because while logs record biological indicator results, their primary purpose in an infection investigation is not inventory management. Option D is incorrect because ultrasonic efficiency is tested in the decontamination area using foil tests or cavitation wafers, unrelated to the final sterilization logs requested for an infection case. Concept extension. Records are generally retained for a minimum of 7 years, varying by state laws, to accommodate the statute of limitations for malpractice lawsuits. Question 3. Healthcare accrediting agencies require proof that sterile processing personnel stay current with evolving industry standards. Which of the following records is specifically maintained to provide evidence of an employee's ongoing training and updated knowledge? A. Shift-by-shift environmental logs. B. Continuing education records. C. Weekly vacuum leak test results. D. Manufacturer's instructions for use. Correct answer B. Knowledge point explanation. Core rationale. Continuing education records are the documented proof required by agencies like the Joint Commission to verify that staff members are continually updating their professional knowledge and competencies regarding new instruments and best practices. Trap analysis. Option A is incorrect because environmental logs track room temperature and humidity, not personnel training. Option C is incorrect because a vacuum leak test only verifies the mechanical integrity of a pre-vacuum sterilizer's air removal system. Option D is incorrect because the manufacturer's instructions provide the processing steps for a device, rather than tracking an individual technician's educational progress. Concept extension. Competency assessments are related documentation where a supervisor physically observes and signs off on a technician correctly performing a specific technical task. Question 4. You are preparing to run a steam sterilization cycle at 270 degrees Fahrenheit, 132 degrees Celsius, that contains several orthopedic titanium bone screws and plates. According to the Association for the Advancement of Medical Instrumentation, AAMI, standards, what specific monitoring device must be included in this specific load? A. A Type 2 Bowie-Dick test pack. B. A biological indicator process challenge device, BIPCD. C. An empty vial of Geobacillus styrothermophilus spores. D. A Type 1 external indicator tape on the chamber floor. Correct answer B. Knowledge point explanation. Core rationale. Screws and plates are implantable devices. AAMI standards strictly dictate that every single sterilizer load containing an implant must be monitored with a biological indicator housed within a process challenge device, BIPCD, to definitively prove lethality before the implant is released for patient use. Trap analysis. Option A is incorrect because a Bowie-Dick test is run in an empty chamber to check for air leaks, not to monitor an actual instrument load. Option C is incorrect because a biological indicator must always be placed inside a process challenge device to simulate the hardest to sterilize location, never just thrown loosely into the chamber. Option D is incorrect because external indicator tape only proves the item was exposed to heat, it does not prove lethality, and it should be placed on packages, not the chamber floor. Concept extension. Implant loads must be physically quarantined until the biological indicator results are confirmed negative, unless a documented emergency premature release is authorized by a surgeon. Question 5. Formal environmental monitoring is a daily requirement in the Sterile Processing Department, SPD, to maintain package integrity and prevent microbial growth. Which of the following parameters represents this type of mandatory formal monitoring? A. Recording the room temperature and humidity levels. B. Measuring the water hardness in the decontamination sink. C. Documenting the impingement pressure of the automated washer. D. Verifying the minimum effective concentration of a high-level disinfectant. Correct answer A. Knowledge point explanation. Core rationale. Recording room temperature and humidity is a critical formal monitoring task. If the sterile storage area becomes too humid or warm, the packaging material can degrade, tape can peel, and condensation can form, instantly compromising the sterility of the instruments inside. Trap analysis. Option B is incorrect because while water quality, hardness, is monitored in decontamination, it relates to the cleaning efficacy and prevention of instrument scale, not general environmental room monitoring. Option C is incorrect because checking impingement pressure is part of mechanical equipment verification for washers, not room environment tracking. Option D is incorrect because verifying chemical potency, MEC, is specific to high-level disinfection protocols, completely separate from the HVAC environmental controls. Concept extension. According to standard guidelines, sterile storage areas generally require temperatures not to exceed 75 degrees Fahrenheit, 24 degrees Celsius, and relative humidity not to exceed 70%. Question 6. A sterile processing technician is tasked with retrieving a specific tray of cardiovascular instruments due to a sterilization failure recall. To definitively identify the compromised tray among others in sterile storage, the technician must locate the lot control label. Which 3 critical pieces of data must be present on this label to ensure accurate traceability? A. Sterilizer identification number, sterilizer cycle number, and the Julian date of sterilization. B. The technician's initials, the biological indicator, BI, lot number, and the expiration date. C. The department name, the assembly station number, and the Julian date of sterilization. D. The manufacturer's serial number, the sterilizer cycle number, and the time of cycle completion. Correct answer A. Knowledge point explanation. Core rationale. The lot control label acts as the definitive link between a physical package and its sterilization record. It must contain the sterilizer identification number, the specific cycle number, and the Julian date to create a unique identifier for that specific load, which is critical for executing an immediate and accurate recall. Trap analysis. Option B is incorrect because while BI lot numbers are recorded in the sterilizer logbook, they do not belong on the exterior lot control label of every package. Option C is incorrect because the department name and assembly station do not provide data regarding the actual sterilization cycle parameters needed for a recall. Option D is incorrect because the manufacturer's serial number identifies the instrument itself for inventory purposes, not the sterilization batch it was processed in. Concept extension. A complete sterilizer logbook must contain these three lot control elements along with the physical printout and the initial verification by the operator. Question 7. An SPD, sterile processing department, clinical educator is observing a new technician manually cleaning a flexible endoscope at the decontamination sink. The educator uses a standardized checklist to verify that the technician is following all manufacturer's instructions for use, IFU. This documented observation process, which is required by accrediting agencies to verify staff skills, is officially referred to as A. A continuous quality improvement, CQI, audit. B. A continuing education, CE, record. C. A competency assessment. D. A professional development interview. Correct answer C. Knowledge point explanation. Core rationale. A competency assessment is the formal, documented observation of an employee successfully performing a specific technical task according to facility policies and manufacturer instructions. It is mandated by agencies like the Joint Commission, TJC, to ensure ongoing staff proficiency. Trap analysis. Option A is incorrect because a CQI audit evaluates broad departmental processes and systemic workflows, rather than an individual employee's physical execution of a single task. Option B is incorrect because CE records track formal educational hours or coursework completed, not a physical demonstration of skills at the sink. Option D is incorrect because an interview is a verbal discussion regarding career goals and employability, not a clinical observation of manual cleaning. Concept extension. Competencies must generally be verified upon initial hire, during the probationary period, and at least annually thereafter for all high-risk or critical tasks. Question 8. In the decontamination area, highly complex instruments with hard-to-reach crevices are often processed in an ultrasonic cleaner after manual brushing. What is the specific scientific term for the mechanical process where high-frequency sound waves create microscopic vacuum bubbles that implode to pull soil away from instrument surfaces? A. Impingement. B. Cavitation. C. Thermal disinfection. D. Convection. Correct answer B. Knowledge point explanation. Core rationale. Cavitation is the precise physical phenomenon utilized by ultrasonic cleaners. High-frequency transducers generate sound waves that travel through the bath, creating millions of microscopic bubbles that rapidly expand and implode, creating a vacuum effect that vigorously draws bioburden out of box locks and serrations. Trap analysis. Option A is incorrect because impingement describes the physical force of pressurized water and detergent spray hitting an instrument, which is the mechanism used by automated washer disinfectors, not ultrasonic cleaners. Option C is incorrect because thermal disinfection uses high-temperature water to kill microorganisms, while an ultrasonic cleaner primarily uses sound waves for physical soil removal. Option D is incorrect because convection is the transfer of heat through circulating air, which is the mechanism used in dry heat sterilization. Concept extension. To ensure the cavitation process is functioning correctly, ultrasonic cleaners must be routinely tested using methods such as the aluminum foil test or commercial cavitation wafers. Question 9. Dynamic air removal steam sterilizers, such as pre-vacuum models, utilize a mechanical pump to extract air from the chamber. To ensure the integrity of this vacuum system and verify that no air is entering through damaged door gaskets or valves, which specific diagnostic cycle must be performed, typically on a weekly basis. A Bowie-Dick test cycle. B. A biological indicator, BI, challenge cycle. C. A vacuum leak test cycle. D. A chemical integrator emulation cycle. Correct answer C. Knowledge point explanation. Core rationale. The vacuum leak test is a specialized diagnostic cycle that measures the airtight integrity of the sterilizer chamber. It pulls a deep vacuum and monitors the chamber pressure for a specific duration. A rise in pressure indicates atmospheric air is leaking into the chamber, which would compromise the sterilization of subsequent loads. Trap analysis. Option A is incorrect because while the Bowie-Dick test also assesses the vacuum system, it is performed daily to test air removal efficiency and steam penetration, whereas the leak test specifically measures pressure changes to detect physical leaks and is typically run weekly. Option B is incorrect because a BI challenge cycle is used to prove biological lethality, killing spores, not to diagnose mechanical seal integrity. Option D is incorrect because chemical integrators respond to time, temperature, and steam quality, but they cannot perform a vacuum hold pressure test. Concept extension. If a sterilizer fails a vacuum leak test, it must immediately be taken out of service until a qualified maintenance technician repairs the leak and verifies the system. Question 10. After incubating a biological indicator, BI, for the required time following a steam sterilization cycle, the technician observes that the liquid medium inside the test vial has not changed color and remains clear, indicating no viable Geobacillus stereothermophilus spores survived. How must the technician officially record this outcome in the sterilizer control log? A. As a positive result, indicating the load is safe for release. B. As a negative result, indicating the sterilization process was successful. C. As an invalid result, requiring immediate recalibration of the incubator. D. As a marginal result, requiring the load to be quarantined for further testing. Correct answer B. Knowledge point explanation. Core rationale. In biological monitoring, a negative result is the desired outcome. It means that the sterilization conditions were lethal enough to destroy all the highly resistant bacterial spores in the vial, resulting in zero microbial growth during the incubation period. Trap analysis. Option A is incorrect because a positive BI result means the spores survived and multiplied, indicating a complete failure of the sterilization cycle, not a safe release. Option C is incorrect because an invalid result occurs when the unprocessed control BI fails to turn positive, which questions the viability of the spores, not when the test BI successfully turns negative. Option D is incorrect because BI results are strictly binary, positive or negative. There is no marginal classification in biological monitoring protocols. Concept extension. Every time a test BI is incubated, an unprocessed control BI from the exact same lot number must also be incubated to verify that the spores were viable and the incubator is functioning.